Well, Mrs. Smith, I just looked at the radiographs and Fido has blown a cruciate. It's in the knee and it's a big problem.
How does it happen?
Well, it's probably because Fido has a high body condition.
Are you saying my dog is fat?
Bottom line, Mrs. Smith, is that Fido is going to need surgery.
Well, how much does that cost?
Mrs. Smith, can you really put a price tag on your dog's ability to walk?
I think we'll wait and see how he does.
Mrs. Smith, that's just wishful thinking. Listen, put yourself in your dog's shoes. How would you like to live with a torn cruciate?
I know, but
if you don't fix this, your dog is going to get arthritis. I could go so far to say as it could be considered cruelty to not fix this dog's knee. Well, Mrs. Smith, I am very sorry to say that Fido has ruptured the cranial cruciate ligament in his left stifle. This tear is often the result of a subtle, slow degeneration that's been taking place within the ligament rather than the result of a trauma of an otherwise healthy ligament. You have the options of an extracapsular repair with a lateral fibellar suture stabilization, which I don't recommend, or a tibial plateau leveling osteotomy, which is the gold standard of care. You see here, the TPLO involves making a circular cut in the top of the shin bone and rotating the contact surface of this bone until it attains a 90 degrees to the patellar tendon. This orientation of the tibial plateau renders the knee relatively stable. The cut in the bone is stabilized by the use. Are you okay? Okay, the cost of the preoperative exam, pre and post radiographs, preoperative blood work, anesthesia, surgery performed directed by a board-certified surgeon, of course, post-operative pain management, it's about $3,000 to $3,500.
Okay, what if we don't do anything?
Mrs. Smith, while the symptoms of lameness and pain may subside with time, attempts to return to normal activity levels will often be limited by the progression of osteoarthritis.
So, I think you're saying there's a chance he'll get better on his own.
Mrs. Smith, thank you so much for waiting while we took x-rays of Fido's knees. I brought them in on this iPad so we can go over them together. It does look like Fido sustained an injury to his knee resulting in a torn ligament in the knee. This is a really common injury and we have lots of ways to treat it now. So we took pictures of both of Fido's knees. Here's the normal knee and here is the abnormal knee. And this little white smudge right here on the knee, this is joint fluid, which indicates inflammation inside the joint. His knee also clicks when we extend it, and I suspect that he has a torn meniscus as well. It's the same injury that NFL running backs and soccer players get all the time.
Yes, I've heard of that injury.
This cruciate ligament stabilizes the knee, and when the ligament tears, the femur and the tibia rub back and forth on each other, grinding away the cartilage inside the joint, and it causes arthritis. So the kicker is, without treatment, Fido will put his weight on the other leg and is at increased risk for an overuse injury in his normal leg.
That makes sense.
Because of Fido's size, the recommended surgery is a TPLO, which is detailed in this handout here. There are other procedure options for treating this injury, but because he is so big, the success rate with the other procedures is lower, and you might still end up needing the TPLO surgery anyway. The recovery time after surgery is about 8 to 10 weeks, during which Fido will need to have pretty strict exercise restriction, and we will teach you a few easy rehabilitation exercises to do at home. The rehabilitation period is as important to recovery as the surgery itself, and we will walk you through that. I've included an estimate for surgery in your handouts to go home. I know it seems like a lot. And detailed discharge instructions if you want to pursue surgery. We can have the surgery done at our clinic. We do utilize care credit here if finances are an obstacle. I do know that the surgery costs a lot, and my receptionist will be able to help you with that, okay?
Okay, thank you. I'll need to talk to my husband, though, I think.
Okay. Yeah, I would definitely say talk to your husband. This is a big decision. So in the meantime, this bag is for you. Keep Fido confined on short leash walks only. Avoid stairs and take him out on a leash to eliminate. You will need to reduce the amount that you feed him by about 20% to keep him from getting fat while he's on exercise restriction. I'm going to send him home with some pain meds. And so this is going to make him feel better. So he's going to think that he feels better. So you're going to need to make sure that he's not out running around on his injured knee because he feels so good. So I know this is a lot of information. All of these instructions are included in your discharge packet, and if you have any questions, don't hesitate to ask. One more thing to consider, laser therapy is a great adjunct therapy to use with surgery. It speeds healing, reduces inflammation, and pain, and there's a handout on that as well in your bag, as well as pricing and the benefits for it. So seems like that's pretty much it. Do you have any more questions for me at this time?
Are there any other options besides the surgery?
Absolutely. You can elect to pursue medical management, and basically that's giving pain medication. There are alternative therapies such as acupuncture and the laser therapy like we talked about, but while they will help Fido feel better, they won't cure the condition, and they will not delay the onset of osteoarthritis. Surgery is best, but we will work with you to determine whatever is best for you and your family.
Thank you. That's been very helpful. I really feel like I understand my options. I appreciate it.
Good, good. Either I or one of my staff will give you a call in a couple of days to see how Fido is doing and determine what your next steps are, okay?
Okay, thank you.
You're welcome.